Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership in Business podcast, where urologic professionals experience the practical application of business acumen essential to successfully navigating today's rapidly changing business environment. I am Dr. Jennifer Miles Thomas, and in today's episode, we will discuss how advocacy in urology can empower physicians to make a change across multiple levels. Joining me today for this discussion is Dr. Ruchika Talwar. Dr. Ruchika Talwar is currently finishing up her fellowship and will be staying on faculty as a urologic oncologist and medical director of the Office of Episodes of Care at Vanderbilt University Medical Center. She is a health policy researcher with interest in advocacy, payment reform, quality of care, and reducing financial toxicity for patients. Last year, Dr. Talwar served as the 2022 Logan Holtgrewe Legislative Fellow, and in that role, she spent the summer working on health issues in Congressman Darren Soto's office in Washington, D.C. Welcome, Dr. Talwar.
Thank you so much, Dr. Miles Thomas, for having me on the podcast today.
Oh, it is my pleasure. I think this is definitely a hot topic as our world is changing before our eyes. So let's just get into it. So we hear a lot about the word advocacy. What does it really mean? What is advocacy?
It's a loaded question, believe it or not. So, when you look at the definition of advocacy, it means, or it is defined in the dictionary as activity by either an individual or a group that really has the purpose of influencing decisions within political, economic, or social institutions. But truly, especially in medicine, I think advocacy means different things to different people. It can be as small as working on a particular issue for your individual patient, something like making sure they have access to the right treatments or the right medications. Or it could be as broad as doing what I did this summer, where you're working in Washington, D.C., helping to shape policy that influences the health of entire communities or populations. Advocacy is really broad, but in medicine, I think it really gives us the power to shape how we practice and how we deliver care for our patients.
Well, that sounds great, but do people actually listen to doctors?
Great question. And I can actually say from experience now, they really do. You think about it, there's in 2022, there were only 17 physicians in Congress. Okay, 17. Yet think about how much of policy and legislation is focused on healthcare issues. I mean, it's way surpasses that proportion of MDs to people who have no healthcare experience. So because of that, congressional representatives need to turn to organizations or doctors or experts that they have built relationships with in their community. That's why you have organizations like the AUA working to spend time with congressional representatives, both at things like the Advocacy Summit, but I would argue more importantly on a day-to-day basis when we have a policy team that works really hard behind the scenes to get our leaders in touch with the right people when specific issues come up. So, again, I'll say, drawing from experience this summer, I cannot tell you how many times there was a health related issue that I was not working on. It was something peripherally, peripherally related to healthcare that was in another person's portfolio. And they'd be like, hey, Ruchi, come take a look at this. Tell me your perspective. And I have left the Hill. I mean, it is now end of October. I left the Hill in August, yet I still get emails and texts and, people reaching out, just asking to pick my brain on things. So I'd argue they really do listen. The hard part is building that first bridge.
Mm-hmm. So can you talk about that first bridge? Just what should we be doing? I mean, 17 physicians in Congress. How many of us are there across the nation? Just how would someone even get started? What's the best way? Everyone is strapped for time. So just how important is it?
Yeah, I think you bring up a great point when you say everyone is strapped for time. There's only 24 hours a day. And I know that physicians are extremely busy, dealing with regulatory burdens, but also just providing care. And to be frank, they didn't really sign up for this, right? So I get it. I get it. I think it depends on how passionate you are about the issue. I will start with what I hope urologists across the country will consider, and that is what I call sort of the bare minimum. And the AUA makes it really easy for us to be engaged in that bare minimum. They send us email blasts when there's an important issue coming up. When there were major Medicare cuts looming last year, everyone got an email. And all you had to do was click on the email, put in your address, and it automatically sent a template to your local representative. Those matter. Again, I can tell you, there was an entire person in Congressman Soto's office who read every single constituent email. They read every single one of these, and they will say, today, 24 physicians from your district reached out because of those Medicare cuts. Congressional representatives listen because in the end, all they want is your vote. Now, that is the bare minimum. If you are so inclined, there are varying levels of opportunity within organized medicine. I would say at your section or at your state, it's incredibly important to be engaged because often those state or local issues affect you faster and sometimes even more than some of those national issues. And I'd argue it's a lot easier to have your voice heard on that local level. Your local representatives are really looking to get your input and they do see you as experts. Now, for those who are really passionate and want to get involved, serve on one of your AUA committees. You have the LAC, the Legislative Committee through the AUA. You have the Public Policy Council. For trainees, you have the Advocacy and Policy Work Group that was created to get like-minded individuals together and learn more about how trainees can affect this space. So there are varying ways to get involved, and a lot of those opportunities are through the AUA.
So that makes sense, but so far you're talking about all of the positive aspects. Can we really make a difference? I mean, there's the whole conversation about Congress, what gets done. We don't have time. Honestly, during your time in Soto's office, did you feel like you made a difference? Because that's what we're all asking. Is it worth the time?
Yeah. And I think to answer that question, I'm going to take a step back and give you a little bit of that 10,000-foot view.
Perfect.
It is really easy to feel discouraged and to feel frustrated by the headlines that you're reading on whatever news source it is. It's every single one. We're not even going to get into that, but it's every single one. It's sensational headlines sell. I can tell you from experience, the majority of the work done in Congress is actually working to improve society. You think when you're there, oh, Republicans don't talk to Democrats and Democrats don't work with Republicans. That is not true. A lot of the time I spent collaborating across the aisle on health related issues. I was in a Democratic office in Congressman Soto's office. I co-authored on behalf of Darren Soto, I'm not on behalf of myself, but I co-authored a letter with Representative Neil Dunn's office, a Republican, to basically focus on clinical trial related data and the transparency of that. We worked to get Congressman Soto on bipartisan legislation. I personally signed him on to 10 healthcare related bills that had to do with the burden of prior authorization, reducing various regulatory burdens, increasing transparency in prescription drug pricing. And in fact, by the time I was leaving his office staff was actually laughing because he signed up to be on drug pricing issues on a specific committee that he's on. And everyone was like, what? this has never been an interest of his. Meanwhile, I was there for, 2 months, like harping on drug pricing and how we need reform. And so, you really do make a difference. But again, that's just my experience. Let me give you two examples of how the AUA has been really effective in this space.
Mhm.
First, let's talk about prostate cancer screening. This example has been beat to death, but I think it really illustrates the importance of this work. So first, back in 2008, we had the ACA pass, and under that law, there was this agency, the United States Preventative Services Task Force, the USPSTF, and the ACA effectively mandated zero cost sharing of any sort of preventative services that the USPSTF recommended. Then through that, essentially, it also said, okay, that means that if a service is not recommended by the USPSTF, we don't have to, insurance companies or Medicare or Medicaid doesn't have to pay for that service. In 2012, because of some flawed data that was released, the USPSTF recommended against prostate cancer screening. In that decision, they had basically no input from urologists or urologic oncologists, no experts in prostate cancer. It was really a panel of primary care physicians, well intentioned, but they were just missing that key stakeholder input. Then, primary care physicians started recommending against prostate cancer screening. Tons of cases went missed. And if you look at the numbers, we're actually now seeing an increase in the presentation of de novo metastatic disease. And prostate cancer, very concerningly, is the only malignancy that has increased in mortality, which is crazy. And it's actually a direct effect of this policy. Now, the AUA sprung to action. Right away, they started advocating on our behalf through various means, whether it's federal agencies as well as on the Hill. They actually have encouraged and gotten co-sponsors for legislation that centers around USPSTF transparency and making sure in the future there are experts on these, I should say, giving input for these decisions. More importantly, we were able to actually change that grade to a grade C, which is a lot more appropriate. It's shared decision making. And a lot of that was because of our advocacy. So that's one example of how advocacy works. The other example is in pediatric urology. There were a lot of very active patient advocacy groups, I should mention, who had some really important points about the historical practices that perhaps were not the most ethical, that surrounded how we provide reconstructive urologic care in newborns. However, instead of having more collaborative discussions on how we can sort of improve the care that we deliver, a lot of legislators were listening to these patient advocacy groups, which I think is great. However, again, the problem is you're not having expert input. You're not having pediatric urologists up at the table when these decisions are being made. And then all of a sudden you get legislation out there that's actually banning newborn circumcisions or, medically indicated urethral reconstruction so that patients can actually, void babies can void per urethra. So that's the problem, right? You're having these. We'll leave the other discussion aside of the ethics of that stuff. My point is, there's medically indicated, medically necessary, appropriate procedures that are included in a blanket ban, and pediatric urology and the AUA really sprung to action, and they were there. They were testifying at state houses during congressional hearings at the state level, and they were able to prevent the passage of some of these bills. Now, you'll notice a common theme. In both instances, organized urology was forced to be reactive, not proactive. And I think that really drives home the point that we need to be engaged as these decisions are being made before they're implemented. And what that means is showing up at the table, getting a seat at that table, making sure that some of our time is spent on advocacy related issues so people know that we're there, our voice is heard prior to a problematic policy being implemented.
That makes complete sense. I frequently think about what the consequences are if people are not engaged, because it does take additional time and effort. But just like you said, if you're not at the table, you're on the menu. People will move forward with policies that will directly affect our specialty and our patients' lives. And I think your examples were great. Well, we also know in our world that there is a lot of conversation regarding burnout, right? And part of the burnout, I would say, is because just the workforce that we have, but there are a lot of other regulatory issues at play. Can you just comment about how advocacy could help?
Yeah, that's a great point. So I think advocacy can tackle burnout in multiple ways. First, as you're talking about, we are fighting to ease some of those regulatory burdens. Again, I'll give you a couple examples. One is prior authorization. The AUA Public Policy Council has been fighting really tirelessly on our behalf to try to ease some of these prior auth burdens and get things like a gold card in place where, if you're ordering a certain test in a certain situation, you get to bypass the prior auth process. Or creating reasonable limits. You only need one prior auth in however many days, or prior auth should not be implemented in the specific instance of this cancer type or whatnot. So, that's one way we can ease some of the frustration surrounding things like prior auth. We also are fighting pretty hard to get telemedicine to stay, because that has helped us in a lot of ways avoid some of the frustrations that our patients face, such as issues with parking, high parking costs. When you're driving into a city at a major medical center, there's traffic, there's frustrations, missed time away from work, missed wages, all of that stuff. But beyond just these like regulatory burdens, I think advocacy helps fight burnout in another way. I can speak from personal experience. For me, advocacy helps me feel engaged in the work I do. It really helps me feel like I'm making a difference. I'm fighting to improve the system instead of just being a cog in the wheel. And, that feeling when you see actual change coming from what you've been advocating for. I mean, I can't describe that feeling. It's the best feeling in the world. When you're able to see legislation pass that increases prostate cancer research funding in the VA health system, when you've gone 5 years in a row on the Hill and talked to your congressional representatives about the importance of prostate cancer research. I mean, it's just a great feeling.
Well, I'm a believer in energy, and I can see your energy and the fact that you're passionate about, hey, I came into this world, I figured out how I can make a change. I started seeing the change, and that's why, and it's fueling you to continue. And I definitely think there should be more of us walking that path with you. If someone were to come to you and say, well, I have some concerns, they haven't been addressed, how can urologists at like every level get involved? Because there's going to be different levels of commitment. So
Yeah.
kind of what's the broad range of how someone would get involved?
Yeah, that's a great question. And that this, I would argue, is probably the biggest take home that I hope people are able to hear from this podcast. So I'll start at the trainee level, because I think we're actually seeing a wave of super engaged young urologists passionate about all issues, some of them social issues, some of them work force related issues, some of them burnout. So for trainees, the AUA has this awesome work group, the Policy and Advocacy Work Group. In fact, I believe they're actually accepting applications right now. So you'll see those email blasts, and you can also stay engaged on social media platforms like Instagram, Twitter/X, and other mediums that the AUA uses to get information out there. But that work group is really special because it respects the fact that trainees don't really have a lot of time to dedicate to this. They're super busy. But, once every couple months, it gets like-minded individuals together and allows them to brainstorm on how to get the word out to fellow trainees about policy related issues. And they conduct these interesting fireside chats that are streamed on weeknight evenings for trainees to learn a little bit more about, important issues in this space. The Advocacy Summit is another way that people who want to learn more about the AUA's advocacy work can get involved. And this is at the trainee level, young urologist level, and very seasoned senior urologist level. Everyone flies into DC. For the first day and a half of the summit, you learn about all of the issues that urology is advocating for, and you learn about specific policy related issues that are affecting the practice of urology. There's a series of panels and presentations from experts outlining all of this. And then towards the end of the second day, you actually go and you meet with your congressional representatives. You do what's called Hill visits. And this is a really common practice, believe it or not. When I worked on the Hill, I took all of these meetings, and it was often like 2 or 3 a day. Again, I'll refer back to the fact that there's only 17 positions in Congress, yet congressional representatives get inundated with healthcare related legislation, issues, complaints, and it's a really critical process for your representatives to hear your input on this. But the point I want to make is every other field dedicates like a lot of money to hiring people whose whole job it is to go and lobby and advocate for issues. So you have people from pharma spending days and hours and going to meet with every single office to emphasize the importance of their issues. We don't do a good job of that, honestly, compared to pharma and the hospital lobby and all of that. So I think that those congressional visits are a critical part of the summit. And, it may seem a little weird to like go to your congressional office and often I should mention meet with like some 22-year-old, staffer. And you're like, why am I meeting with this like teenager who doesn't know anything about what I practice? I promise you they're listening. They take notes. Those 22-year-olds that are running around the Hill are the ones who are actually in the ear of the representatives, often deciding what stance is going to be taken or what information, they're making decisions on. So those visits are critically important. And I encourage all who are interested to at least attend one advocacy summit. You get CME credit for it. It's a couple days out of the year, and it's through the AUA. Registration is also free. So it's a great opportunity. Now, for people who are already engaged and have decided they want to make a bigger time commitment, there are various ways to get involved both at the section and at the national level. Every section has a health policy committee, and I did reference this earlier, but often those health policy committees are very responsive in real time to local issues that are affecting your community and may affect the way you practice healthcare. So I certainly would recommend getting involved at the sectional level early on. It's also less of a time commitment. But for those, again, who are super engaged in this, they can join the AUA's national committees. There is the Public Policy Council, the Legislative Affairs Committee. There's also a state advocacy committee that, again, is very responsive to things like emerging legislation in the trans care space that affects reconstructive urologists. They have been really involved with legislation at different states that has to do with medical chaperones. Because again, we often do sensitive exams, and it sounds great to have a chaperone present, and I think it's a valid point, but you have to realize who's paying for the chaperone, who's training the chaperone, what is the implementation of that process. Am I going to be, penalized if I don't follow specific rules? And So I think, again, it's important to have our voice heard and say, hey, listen, our nurse should be able to count as a chaperone, so we don't need to hire another full-time position. Um, the list goes on and on about the state issues. They do a great job at the summit of presenting an overview of that, but there are a lot of opportunities. And I think the first decision someone needs to make is, how much time am I willing to devote to this? And being honest and saying, I really don't have time right now. Again, the bare minimum is just opening that email you see from the AUA when there's an important policy related issue coming out, clicking on the link and just making sure that your voice is heard.
That's fantastic. So many opportunities out there to get involved at so many different levels. And truly, if someone decides how much time they have available, there is an opportunity for that too. That sounds great. Well, thank you so much. You've given us so much actionable information, but is there anything else you want our listeners to hear?
I just really want to emphasize the point that, it may seem hopeless. It may seem really frustrating when you read headlines out there. Lord knows I myself didn't know what to expect before I was heading to the Hill. And, people were joking with me because they know how passionate I am. They're like, are you gonna make it? Are you gonna survive? And when I was there, I was just so encouraged by the level of collaboration, collegiality, and camaraderie that really is present in Congress. Those headlines don't sell, frankly. I mean, the story of how you have bipartisan legislation to get funding to fix local highways or to make improvements at the airport or to open a new nursing school or hospital, in your community. Those don't sell. Those don't make the headlines of CNN or Fox News or whatnot. And so you don't hear about it. But I promise you, it is happening. There are so many representatives in Congress whose names you may not know. I didn't know, Congressman Darren Soto's name, but there's a really interesting tool out there. It allows you to look at the effectiveness of your representative. It's called the Office for Congressional Effectiveness, essentially, and they score your representative based on how much legislation they're putting through or how much funding they're getting for their local community. And it's the names you haven't heard of that have the highest scores because they're not worried about the sound bites. They're working for their constituents. So get to know your representatives, introduce yourself as a resource for them. You don't need to do that in DC. You can do that by just sending an email or, visiting your local office. Every congressional representative has a local office. If you feel so inclined, invite them to your clinic. We had that in back in Philadelphia when I was doing my training there. We had Dwight Evans come out, who's our local congressional representative, and what an amazing experience to be able to give him a tour of our clinic and show him what we do day to day. And it builds an understanding of the challenges that we face. And at the same time, you are availing yourself as a resource. And their office will, I promise you, they will reach out to you when they have a health related issue. And what better way to get, your voice heard than to be that expert?
Well, thank you. This has been amazing. And thank you very much, Dr. Talwar, for sharing your time and expertise with us today.
Thanks. I'm really, honored to have the opportunity to share some of this with the urologic community. And I just hope that it inspires one or two people to be a little more engaged on these issues.
And thank you. And thank you to our audience for joining us on the AUA Leadership and Business Podcast.
Thank you for listening to the Leadership and Business Podcast. We invite you to discover the full range of leadership and business programs offered through the AUA Institute for Leadership and Business. Simply visit auanet.org and navigate to the Leadership and Business tab to learn more.